You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Faw, and we're very glad you joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today, we're talking about women's health, which is exciting to me, but perhaps not to all of our male students taking the show today. And we have Dr. Mona with us. Thank you for being here.
I'm glad to be here.
And you're not just new to the show, but you're new to the area. So
Yes.
I doubly thank you because I know how busy you are. Women's health, it's a huge topic. We could cover lots of 30-minute shows. But talk about your title or your credentials are OBGYN. Talk a little bit about what that profession is and what you do.
So mainly I see only women.
Okay.
And I cover broad range of ages.
Okay.
So from the teenager year, so starting 13, 15, and up to menopause or even older.
Okay. So you do see people after menopause?
Yes.
Okay.
Yes.
But only women?
Yes, only women.
Okay, good deal. Kind of like a prostate exam. Ladies aren't eligible to come to the prostate exam. Men aren't eligible to. Okay, good deal. So you said women start coming, or young ladies start coming to see an OBGYN when they're about 13 or 15.
Yes, the American College of Obstetrician and Gynecologists recommended female in the age of 13 to 15 to start going to an OBGYN.
Okay.
Not necessarily for any pelvic exam or anything like that, but just to kind of establish care, more like a establish educational, visit.
Okay. So I was going to say, do they start when they start their first period, or do they come sometimes before that, like you said, just to establish a relationship,
Yes.
have that
Yes.
practice in place?
Yes.
Okay.
Yeah, you can come in just as a routine visit, or sometimes they may have some problems which need some attention.
Okay, so any time in the teen
Yes.
years. Okay. How often after that do most women come to see an OBGYN? Is it always annually, or?
Well, it's recommended to go annually to see the OBGYN just to make sure everything, all the kind of well woman exam, all vaccination or any screening is done and routinely.
Talk a little bit about that. The screenings that women often come in for, what are the recommendations? Have they changed? Screening recommendations for all kinds of screenings have changed over the years. So how is that true for the women ones?
Well, the screening for cervical cancer recently actually just changed. So we don't do any pap smear for any woman younger than 21 years old, regardless of their sexual activity.
Okay. What about if they have a family history? Does that change things?
No.
Okay.
That's so 21 and on.
Okay. What about other screenings, other tests that you do? Is it pretty much annually that a woman would come in for that?
Yes, yes.
Okay.
And then once you get to age of 40, you start doing a mammogram screening.
Oh, yes. Mm-hmm.
Yes. And then 50, of course, colonoscopy.
Okay.
And then once you turn menopause, about 15 years after you turn menopause, you want to do a Dexa scan. Make sure that your bone density.
Okay.
Yes.
Okay. And I always talk about in the beginning of the show that this is not to take the place of regular medical care. That you're either your general practitioner or your family doctor. You need to talk to them, and you need to talk to you as well, because I want to arm people with information on here, but I don't want people to self-diagnose or say, oh, well, I'm not this age or not that age, or I don't have any problems with that, so I don't want to see. So that's why I think it's important to have a relationship with your physician, to talk that over so you can figure that out with your physician, not you being the only person determining that.
Yes.
Right?
I agree.
Okay. So a lot of those screenings are annual, and you and your office staff, they kind of figure that out and set up appointments based on what the recommendations are, or what that person needs to do.
Yeah.
Okay. Speaking of your office, we'll just throw your phone number out there now. How can people get a hold of you if they have questions or if they're looking for an OBGYN?
They can get a hold of our answering service or the call service for NOMS service, and it's 419-625-2841.
Okay, and your office is located in Harbor Light Landing here in Port Clinton? Okay,
yes.
Great. That's the closest one here.
I'm over there Monday and Friday.
Okay, good deal. So other than routine screenings, what are some of the more common reasons that women might come see you?
Well, I mean, there's many reasons. You know, sometimes they have trouble with menstruation.
Okay.
Either a lot of cramping or irregular bleeding.
Okay.
Or they would like to, have a consult on birth control pills or any birth control methods, or any issue with
anything.
Related to any of your female reproductive system.
And I think that's sometimes good to have set that relationship up earlier, because a lot of these things are very personal, and you don't really want to talk about them with anybody, but when you have a question, you should seek out your regular practitioner, your OBGYN, or your family practitioner, whoever you go to. And I asked you before we started if there are websites out there that you recommend, and not necessarily.
No.
And I get that with a lot of people, because while the web is full of lots of information,
that's true,
it's also full of a lot of misinformation out there, and you don't want people, I heard somebody talking the other day. They said, when I get onto WebMD, I'm sure I have about 70 different things that I've scrolled through on there. Yeah. Does that happen in women's health as well?
Oh yes, definitely. That's
Women come in and say, I have whatever.
They do their own research, on the web, and then it's like, I think I have this and this and this. I mean, it's good to have an idea, kind of figure out what type of symptoms you have, but always confirm it with your OBGYN. Okay.
So you deal with women's health all over the place, and you also deliver babies.
Yes.
Yay. Where do you deliver? Because I know we don't deliver at Magruder right now.
No, I deliver over at Firelands Regional Medical Center.
Okay.
Yes.
Good deal. So you can do the whole spectrum.
Yes.
All right.
So I'm pretty much taking care of women from reproductive age to after menopause.
Or
yes.
Behind. Okay.
Or beyond.
Do you help with infertility, people who have infertility issues, or is there another subspecialty for that?
Well, I do for kind of like straightforward treatment.
Okay.
But when it comes to if they need IVF, in vitro fertilization, or anything like that, I have to refer them to a specialist.
Okay. So you really can help the full gamut, and then if there's other things that need a more specialized practitioner, you can do that. Okay. Talk a little bit, we have a whole list of topics in just a few minutes before we take a break, but talk a little, there's so many different issues, fertility, prenatal health, pick one. But let me start. What about PMS?
PMS? What about it?
Is it real? Do people come in to see you just for that? It's not necessarily, or is it a biological thing?
I mean, there is different gamut of PMS.
Okay.
It's a spectrum. Okay. There's not only, this is a PMS, and there's different degree to it too.
Okay.
And then every woman is different.
Okay. Does it change throughout their lifetime as well?
Definitely.
Okay.
Because as you age, your hormone level changes also.
Okay.
And then there is no one recipe that can take care of all.
Okay.
So you have to pretty much adjust throughout your life.
Because there's physical symptoms of PMS, there's psychological symptoms, there's all kinds of symptoms, and it's all hormone related.
Yes.
Oh, goody.
Unfortunately, yes. All women that have to go through.
So that's something that you could help someone with.
Yes.
That kind of stuff. Okay. And then one of the other things, and my daughter is very young, so I know just enough to be dangerous, but the HPV vaccine, can you talk a little bit about that before we take a break?
HPV vaccine is a human papillomavirus vaccine.
Okay.
There is a lot of research that kind of links this human papillomavirus to cervical cancer.
Okay.
And about 70% of them are caused by the high-risk type.
Okay.
And then there are 2 FDA-approved vaccine out there for HPV.
And when does a person is it usually young women who get the vaccine?
The recommendation is between the age of 9 to 26, and it's preferable before they become sexually active. That way it's more preventative.
Okay. So there's a vaccine that can help with that virus, which has been linked to cervical cancer.
Yes, but
there's always a but.
there's many strains of this HPV, so human papillomavirus, and the vaccine only covers 2 types.
Okay.
So even though you get the vaccine, you still have to follow up, be compliant with your pap smear, the screening.
To make sure that you don't have a different strain.
Yes.
Like all vaccines.
Yes, that's true.
Okay, all right. So that's just one of our topics we're going to talk about, but right now we're going to take a quick break and we'll be right back. Dr. Mona talking about women's health. We kind of hit on a couple of different topics, and I briefly mentioned before about fertility. So, you see women through their whole lifespan of women's health issues, whatever those might be, and so you see them when they're young, and then also when they're in childbearing years. And some people, it's very easy for them to have children, and some people have fertility problems. And you said you can help with some general conditions that might be preventing somebody getting pregnant, and then if beyond that they have to go see a specialist perhaps.
That's correct.
Are there the top 3 things that you see in fertility issues, or are there just kind of general health issues that impact fertility, like just heart conditions, or?
There is many reasons that it can cause infertility. There could be irregular bleeding. That means they have unovulatory issue. So they don't ovulate every month.
Gotcha.
So it's more difficult for them to become pregnant.
Okay, gotcha.
And
you can help them narrow down all those causes.
Yes,
Okay.
yes.
All right.
And of course,
And then once somebody becomes pregnant, there's a whole realm of prenatal health that they come see you very regularly.
Yes.
And towards the end, really, really regularly.
Yeah.
So talk about prenatal health, and it didn't used to be around, and how has it changed, and what all is it about?
Well, right now I think we're focusing more like a good state of health when you get pregnant. That's very important, because that will determine whether the pregnancy course is going to be low risk or high risk, or usually if you're in a good state of health, your pregnancy outcome tend to become very, very good.
Okay. So there's multivitamins and ultrasounds and all kinds of fun stuff that you do. You see somebody every month?
Well, in the beginning, when you're in the first trimester, usually you see us every 4 weeks.
Okay.
Up to your late second trimester, and then every 3 weeks, and then every 2 weeks, and then
every week.
Yes, once you hit 34 weeks, 35 weeks, you come into the office every week.
Okay. And what do you do? What are you looking for in those visits? I know you always check the weight, and oftentimes they'll be listening for heartbeat and things like that.
Yeah. We want to make sure that your blood pressure is controlled, is normal, and then make sure that you're gaining weight appropriately.
Right. Not eating too many hot fudge marshmallow milkshakes.
And then we also
hypothetically.
And then we also measure your fundal height, measuring how the uterus grows. Kind of gauge how the baby's growing too.
So you can tell if the due date is still the right due date and all that kind of stuff.
Well, you don't really change the due date once you establish it, but making sure that the baby's not growing too fast, or maybe or not growing enough.
Okay.
So.
And you can find out so much more about the health of your child in utero now, like if there's heart conditions and all kinds of things like that. There's lots of things that you can do now that were never before done. What do you think about that? Is that good, bad, indifferent?
I mean, if you are the type of person who have a lot of problems, like meaning a health problem,
Okay.
and you worry about whether your child is going to have it or not, you may want to opt that way, do all the testing.
Gotcha.
I don't know if all the invasive testing are necessary, but if you're pretty healthy otherwise, I don't think all those, additional testing are necessary.
And if somebody has, I had all my kids after the age of 35, and 35 is some sort of magical number, and there was a whole magazine to childbirth after 35. I was not aware. What is the reasoning behind that? Is it a little riskier? Is it?
It has become riskier if you deliver older
Okay.
than 35 years old.
Okay.
The number one problem is because your health issue may not be as
Okay.
good as when you were younger.
Sure.
And of course, the quality of egg that you have.
Okay.
Because, in women, you don't produce eggs every month. You're pretty much born with the amount of egg that you're going to have for the rest of your life.
Okay.
So,
Okay.
if you're 35 years old, your eggs is 35 years old.
Okay. Now I see
That's
why
why.
there's a whole magazine dedicated to childbirth after 35. Okay. And so, what are some of the vitamins and nutrients? I interviewed Kim Lenahan. She's one of the dietitians at the hospital, and she talked about zinc and folate or different things like that. What are some of the things that you need to be careful of during pregnancy, or things that you need to beef up on?
I think the basic is I always suggest, like, all my patients, if they're thinking about conceiving, start prenatal vitamins about 2 to 3 months prior to trying.
Okay.
And then, like what I say, if you're in a good health condition, prenatal vitamins should be enough.
Okay.
But if you have a prior child with spine issue, either they have an open spine or spina bifida, and then we recommend folic acid supplements.
Okay. And all of that, we don't have to know that. You know that.
Yes.
You guide
So
everybody on the journey.
Yes.
Okay.
So come in and talk to us.
That's why you come in so often,
Yes.
because there's a lot of things to think about and all that kind of stuff. All right. Deliveries, you deliver the babies as well. And you do regular birth and C-section and all that fancy stuff?
Yes.
Okay. However it needs to come out,
Yes,
you
and
can help it get out.
Yes. And I also do trial of labor after C-section, but it has to be,
Okay.
you have to meet certain criteria in order to be able to try that.
And why is it that it's a little bit harder after you've had a C-section to have a regular vaginal birth?
Well, it's not as a little bit harder, but it depends on what the reason for your previous C-section
Okay.
is. If you were in labor for many hours and then you stop dilating and then you end up having a 9-pound baby,
Gotcha.
that means, your pelvis might not be big enough for, childbirth.
So C-sections might be how it's going to be. Okay.
Yes.
Okay.
But if the reason is because your baby was breech,
Gotcha.
so your next
You could have
pregnancy,
a regular.
you can try
Okay.
vaginal delivery.
Okay.
Yes.
Good deal. And probably one of women's favorite topics is menopause. Kind of going through the lifespan here, but talk about menopause. And thank you for telling me at the break I'm too young for it. Right?
Well, menopause, the definition of menopause is not having your period for 1 full year.
Okay.
But there's also a period called perimenopause.
Okay.
And that could be a couple years, 2 years before you become menopause or 5 years before. That's when you start having hot flushes, irregular bleeding, and then some mood swings and insomnia, weight gain, and then hair loss and stuff. So,
So it's all that menopause means is you haven't had a period in a year.
1 year, yes,
Okay.
12 months.
So does that mean you're done then?
Yes. So you're done then.
But then what?
But
There's
if
always
you
a
have
but.
but if you have any bleeding after you have no bleeding for 12 months, you definitely need to come in and see us, because that's concerning. If you become menopause and then suddenly you restarted your period or even spotting.
Okay, something's going on.
Yes.
Just come in and see you. Don't
Yes.
self-diagnose, just come
No.
in. Okay. And you talked about one of the screenings was a Dexa Scan. So also bone health is very important.
Yes.
always, but later in life especially. Talk a little bit about that. Is it more important after menopause or?
Yeah, so after you become menopause, you have less estrogen in your body,
Okay.
which will affect the bone health. So
Okay.
when you turn to menopause, your bone density could decrease.
Okay.
So that's why it's very important to kind of monitor the
scans.
density of your, yes.
Okay.
And then that's why it's important for you to kind of keep up on the calcium, vitamin D.
Okay. And Kim was saying, because we were talking about nutrients, and she said actually it's also very important in young age, because that's kind of when you build it up the best or build it up the most, is when you're younger, to have a healthy store of it for when you're a little bit
Yes,
older.
that's correct.
Is there anything that we've missed, or it's such a broad spectrum of services that an OBGYN, it's not just delivering babies and that kind of stuff. What other kinds of things do people come in and ask you about, or?
There's a lot of issue with like between 40 to 50 or even older. A lot of women has issue with incontinence too.
Okay.
So we can take care of that also.
Okay, good deal. Do you have people that come in who have questions about STDs? You handle the whole gamut.
Yes.
The whole area that makes people really uncomfortable, you do the whole thing.
Yes. People share with me. Yeah. They open up. Mhm.
Well, and I think that's kind of why we do this, and why I say that in the beginning of the show, is that, one of the most important things is to have that relationship with your healthcare provider. Because if something's
That's
not
true.
right, or something you're not sure about, or something's bothering you, you need to ask somebody.
That's
And
true.
what more friendly face than to ask you? Any final thoughts or tips for anybody, women, just general health, get your screenings, that kind of stuff?
Yeah, just make sure you can keep track of your annual visit.
Okay.
Make sure you're up to date on your pap smear,
Okay.
or even just a physical exam.
Okay.
Make sure everything is okay.
Even if everything, like you said, is okay,
Yes.
you need to know that, so that if something were to happen, no, that's not normal for me.
Yeah. Or you can, even though everything is okay, you can start working on preventative stuff.
Okay.
So-
There's a novel idea. Are there any special things from a women's health perspective in terms of prevention other than screenings?
Of course, keeping a healthy body weight and then
Sure.
exercise.
Yep.
And then as you age, Kegel exercises for
Okay.
anybody who, had a child previously.
Okay. Yep. Okay.
And then nutritions and everything.
Okay. A lot of very
Yes.
similar to other areas, whether we're
Yes.
talking about diabetes, the exercise and proper nutrition is a big part of it. So glad to see that thread through everything. All right. Well, thanks for being here.
All right. Thank you
All
very
right.
much.
We're going to take another break, and we'll be right back. And we're back. I want to thank Dr. Mona Nataprawira for being our guest today, talking about OBGYN and women's health. And again, it's kind of an area that a lot of times makes people uncomfortable, so all the more reason to have a good relationship with your physician and to find a practitioner that you're comfortable with, whether things are going swell or if something's not quite right. It's just a really important area for the ladies out there. So, and to reach her, I'm going to just list her phone number again. Her office is out at Harbor Light Landing on Catawba, and the phone number is 419-625-2841. So if you have questions or if you're looking for an OBGYN, there she is if you're interested. So again, broad topic, whether there was something on here that piqued your interest, or if you want to share the information or share the episode with somebody, we always encourage you to do that. And if you ever have feedback about a program or a suggestion for a future episode, let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Carla Pelz at the high school, cpelz@pccsd.net. So again, think about something you learned today, whether it would be something important for you or someone else. Act on it. And until we meet again, I encourage you to make time for health.